When you see a patient and they've got early symptoms of the dementia umbrella, do you think in your mind there's a lot we can do for this patient? Or it's going to be a progressive thing and there's not a lot we can do for them?
I think there's always a lot we can do for patients.
And that's great. What is the plan when you think there's things that we can't do?
Well, firstly, we need to come to a diagnosis. So once we arrive at that diagnosis, sometimes it takes several visits, additional brain imaging, and once we get there, we can talk about the treatment plan for that specific dementia type. A lot of times just knowing what you have is the first step, because if you don't know what you have, you don't know how you can plan ahead or how it progresses.
When you find the diagnosis of early dementia, you have to bring in the rest of the family. You have to start thinking about long-term care and how to take care of the person that's involved.
Yes, absolutely. I think there's planning. It's very different in each different type of dementia in terms of what we advise families.
So what do you do? What do you advise them?
Well, do you want to start with Alzheimer's disease?
Yeah.
Okay. In Alzheimer's disease, depending on where you're at, we talk about what drugs are available, where your loved one is at on the timeline. So are you early? Are you moderate? Are you a little further along than you thought? And then what drugs are available. So there are FDA-approved medicines at this time. And then there are clinical trial opportunities. But a lot of the interventions can be non-drug interventions. So we think that some of those tools are really powerful, things like diet and exercise.
So there's lots of things that we can do to help people.
Yes, a lot.